Assalamu alaikum, everybody. Welcome to CxO Global Forum's show on health tech.
I've lost your voice again.
Sorry, I was just introducing myself. I was introducing myself as the co-founder of Ailaaj, a full-stack digital healthcare platform under the Fazaldeen brand. We have today with us a very enterprising woman as a guest who kickstarted her career, namely in the field of gynecology and obstetrics, and now serves in the government of Punjab as health minister, covering a wide array of different aspects of healthcare for
Bilal, we keep on breaking up.
जी अस्सलाम वालेकुम डॉक्टर यास्मीन क्या हाल है आपका
जी बिल्कुल अल्लाह का फजल खैरियत जी थैंक यू
जी I hope you're keeping well and I know there's a lot of talk about Omicron these days, so I would like to obviously get your opinion on how to curtail it and what the government is doing about it. So I have prepared a list of questions for you, Ji. The first one, namely, has to do with your health.
I think you're breaking up again. I can't hear you, Bilal.
जी हेलो जी my voice is coming clear. The first question I had, Dr. Yasmin, was about your career in healthcare. How did you get started as a doctor and where has it led you today?
Well, frankly speaking, how did I get started as a doctor? If you're asking that question, that's a long journey. Of course, that naturally started because I always wanted to be a doctor. My mother was a doctor. I always used to look up to her. और मैं सोचती थी मैं बड़ी होंगी तो I'll become a doctor. And it was a huge challenge for me because I got married quite early and I did all my studies afterwards. And while I was studying in the medical college, I realized there are a lot of issues which need to be addressed. And once I became a doctor, I became quite active in doctors' politics. After doing my post-graduation in obstetrics and gynecology, when I joined as an assistant professor, in Fatma Jinnah Medical College. I then joined the Pakistan Medical Association, and I won my first elections in 1988. And that was actually how I became extremely active in medical politics. I was, of course, very active in politics otherwise, in students' politics, because was the general secretary of my students' union in Fatma Jinnah Medical College. I became the president of my union, but then continued my politics onwards. So I used to do both the things simultaneously. My medical politics while I was professionally working, of course, as an assistant professor. And I continued my services till I retired as a professor in 2010. And that's the time when I joined politics actively, and I joined Tehreek-e-Insaf. I'm sorry, I still can't hear you.
Hello? Can you hear me now?
Bilal.
Hello? Hello?
Gigi, I can see you now, and I can hear you say hello. I can just hear you say hello.
I was just testing it out. So the next question now has to do with when you
What do you think if I switch on my mobile? You can ask me the question on the mobile while I answer you from here. I think because otherwise I keep on losing you and I don't know what questions you're asking.
right now, so I can probably do that.
I think that will be more sensible. Mobile day. I think that will be more sensible. Let's talk to each other on the mobile, and I can answer. So if you give me a call on the mobile, I think I'll be able to hear you more clearly. Yeah. Okay, I'm just joining you. Like this. Yeah. All right. All right. Let's hear you.
So my next question is that when you became the health minister of Punjab, what immediate problems did you see upon taking that position, and how did you help solve them?
Well, when I became the health minister of Punjab, frankly speaking, it was a huge challenge for me. Thinking about, I mean, I had worked in this health department for a long time. And while working in the health department, I had realized that there were multiple problems which needed to be sorted out. And therefore, when I joined in, I thought the first and most important thing that I needed to do was do a need assessment and plan out a proper strategy. What do I need to do exactly? Spent on developing a health sector strategy for Punjab. And the pertinent points which came out, particularly since I was focused on the sustainable development goals, and the major concerns that were being shown in sustainable development goals was maternal and child health and how important universal health coverage was. So we organized a complete strategy that how would we work on it for the next 10 years to bring about an improvement in health. And the most important point which really came up in our need assessment was that we were really deficient where our human resource was concerned, because majority of the posts, about 50% of the posts were lying vacant in the medical colleges, in the faculties, and along with it also doctors working in the rural area. So the first thing that we did, we started employing human resource. And to date, we have employed more than 48,000 people in a short period of 3.5 years. I think we have created history for a simple reason that such a large number of recruitment has never been done before by the health department. It included doctors, it included nurses, it included paramedical staff, it included technologists, pharmacists. So people from all walk of life who had to work in health were then taken in during this period. And we are still continuing on because even after making all this hectic effort, we have only managed to fulfill because we had a vacancy of about 50% of our post. We are now at about 75%. And we are still going on with this process. And hopefully, by the end of our tenure, we should have roughly employed about 80,000 people in the health sector because that would at least ensure that 90% of the seats would be filled, both in the teaching institutions and also in the primary and secondary healthcare. The second important point which really came up to us was that we were very badly placed on our mental health concern because the sort of in some sort of institution which is available, she's going to have a much better outcome for self-pay. And this process now set up the large referral hospital. You want me to continue, Bilal? Okay, but we'll have to reach a question. Well, frankly speaking, I think it has been a totally successful beds were available and facilities were available. And I still remember that we increased our testing capacity from one BSL lab to 23 BSL labs, which is level 3 labs, to ensure that more testing facilities were present for the people of Punjab. And starting from 5 million tests a day, we went up to 25,000 to 30,000 tests a day. But I think the most important success of that whole program was really the formation of NCOC, because you must understand, statistics and data are the most important component of making any effort successful. And NCOC ensured that we had proper data on the disease, that we had proper data on the number of people who had been tested, and we had a pretty good idea because of the data collection what was the infectivity ratio and the infectivity trend in various parts of Punjab. And I think one of the wise things which was done because of all this extraordinary efforts which were done by NCOC is that we didn't have to close down Punjab as a lot of other countries closed down and wrecked their economies. We were already suffering because of we are a poor country. The idea of the economy closing down would have been another disaster. And I think the big help that we got from all that technology was that we managed to do smart lockdowns, which means we only locked down those areas where the infectivity ratio went above 8%. And this has been appreciated all over the world. And I think Economist, which is one of the top-notch magazines, has particularly appreciated the effort of Pakistan, how it managed to balance looking after the disease and also in keeping its markets open and keeping its economy working. And since the incoming of vaccinations March 21, I think we have again done a Herculean effort. The population of Punjab is huge. If you look at it, it's 11.2 million. And if you look at that, that means out of this, all these people being vaccinated, uh, you needed a miracle for it. But we started off in March, and today, in December 23rd, we have vaccinated more than 8 million people. 8 million people have been, at least 8 million have received their first dose, and more than 4.5 million have received the second dose. So, overall, a large number of people have been vaccinated, and our vaccination campaign has again been appreciated all over the world, and it has been appreciated even in Pakistan. And I think one of the most important part of all this was the technology, how technology helped us, how data collection helped us in ensuring that we managed to plan out our interventions properly. So I think I would always say that having maximum information through technology which is available now really strengthens your interventions and helps you to plan out better.
It was very well put, and it's quite encouraging to know that such, as you put it, a Herculean effort was made to get everybody vaccinated. You can hear me now, right? Because we just got on a static connection. Sorry, you just unmuted yourself or muted yourself. Hello? 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 Dr. Yasmin, you're on mute. Hello? Hello?
Hello. Maybe I should just go on with the next question. So you've definitely elaborated on how well Punjab was operating in terms of getting our population vaccinated. And there is, when you put it that way, a high proportion of the population that has received a second dose. And technology definitely, as leveraged by the NCOC, has played a huge part in that. And we've developed a system that is not just one plotted from all over the world, but isn't replicated in a lot of countries in the developing world. And when we come back to technology, it begs me to ask, being part of a telemedicine company, about how receptive the government of Punjab has been in telemedicine initiatives. I do know that around a year ago, when COVID had hit the whole country very badly, not just the Punjab, Chaudhry Mohammed Sarwar had initiated or made a call to action for all telemedicine players who are more or less startups, for-profit companies, start offering teleconsultations for free. So, I mean, it's more of a two-part question. Number one, how well has the government responded to these initiatives? And do you think there might be any scope to induct these initiatives as part of the Sehat card offering as well?
Say it again, Bilal. The last part of your sentence, I lost that.
Gee. The last part of the sentence is, because Sehat card has started inducting a lot of private players in healthcare, but not really any digital players. Do you think there's any scope for digital players to come in the fray or not?
Well, I think the important part is, since we're discussing technology and how important technology is really to streamline the health system, I totally believe in that. Of course, it's extremely important where we are concerned, because over the last couple of years now we have learned how important, and everybody in Pakistan now realizes how important data is. And naturally, with the sort of new technology coming in, it will be impossible for us until and unless we involve ourselves. And when I was talking to you about in the initial part where we employed a lot of people, let me tell you that Punjab Health Department, particularly the primary and secondary healthcare department, has a complete data bank on the number of employees that are employed by us, which is right from grade 21 down to grade 1 people working in the department, which is actually, that's how we discovered all the vacancies which were available in our department. Otherwise it would have been literally impossible, because at the moment I have more than 400,000 people working for us between both my departments. So basically it's technology actually which helped us to sort out our human resource vacancies and human resource deficiencies. At the moment, we are working on developing pharmacovigilance, which is again very important for us. Uh, Government of Punjab spends a huge amount of money purchasing medicines for patients, and we still keep on receiving complaints that patients are not getting their medicines. Roughly this year, we have allocated 42 billion rupees for the medical supplies, medicines, particularly in all our hospitals all over Punjab. There's a huge amount of money being spent, and yet, so we are now working on new app. We're going to work pharmacovigilance, path of the medicine the minute it reaches us and when it reaches a patient, and hopefully it should become effective in the next 3 months. That's what we are trying our level best to do. Then as we are trying to, using technology, trying to make all our hospitals paperless, because the amount of resources you waste on all these things, we think that we need to have a proper HMIS system, a health management information system, in all our hospitals. So we're working on that with PITB. At the moment, one of our largest programs, which is running on Thalassemia Prevention, which is known as the Thalassemia Prevention Program of Punjab, which is considered to be one of the largest prevention programs in the world, that naturally, because of the large population that we have, is at the moment completely being worked through due to the working very closely with PITB. We have developed a complete app, and everything is on. We use technology for it. A field officer working right far out in the field in DG Khan stays in contact with the hospital, Fatima Jana Medical College University lab, when they are transferring their blood samples, and they manage to get their results, and then they manage to give those results to the patients. So it's technology which really helping us to make that program successful.
I'm glad to hear all that, that there's a lot of strides being made. And You're not just looking at the mainstream disease, you're looking at diseases like thalassemia as well. And that brings me essentially to my final question. And I do realize the topic of the show was the use of technology in specialized healthcare in Punjab. Not a lot of people might not know what specialized healthcare entails. So I'd like you to talk just a little briefly on that. And essentially, the main question is what current technologies are being developed by the government of Punjab, which I think you've answered for the most part. But maybe if I rephrase that and to say what you think the future holds for specialized healthcare in Punjab, and how can we use technology to leverage on that, or any other thing that's in the pipeline?
Well, Bilal, just to give an idea to your viewers what tertiary healthcare is, basically tertiary healthcare is made up of a large network of specialized hospitals, which number about 44 in Punjab, which do, include teaching hospitals. Large hospitals they're actually mega hospitals, like Mayo Hospital, which is 2,700 bedded hospital, Jinnah, which is 1,500 bedded hospital. So all these large hospitals actually form a network, and they offer specialized services, which means all disciplines are normally available in all these hospitals, which starts right from neurological sciences to gastroenterology to pathology to accident and trauma. So you name whatever specialization is required, and you have those specialties in all the teaching hospitals. Then there are some of our hospitals have been developed as specialized units otherwise, like Punjab Institute of Cardiology, Rawalpindi Institute of Cardiology, which are only working on cardiac diseases. Then one of the largest hospitals, children hospital, I think in the subcontinent, is the Children Hospital, which has now been upgraded to University of Child Health Sciences. So basically, all our specialized healthcare is made up of this huge network of these specialized healthcare hospitals, while the primary and secondary healthcare is made up of the basic health units, the rural health centers, the Tehsil headquarters, and the district headquarter hospitals. So basically, it's a system which has been developed in continuity, where you start from the primary healthcare, which of course is all prevention and preventive work like vaccinations and everything be done, till you finally come to the specialized curative care, which has to be given in various hospitals. And as I told you, they're all normally teaching hospitals, and hospitals which are training postgraduate people for their further studies. And I think one of the most important part is we're working on developing a very strong telemedicine departments in all our universities, so that we could also communicate with far-flung areas. And this would be one good way to use technology to help out areas where doctors might find it very difficult, or specialists might find it very difficult to reach. So we've been working on it in COVID, and hopefully I think we'll be utilizing this sort of work, this sort of technology for furthering our specialized services.
Wonderful. Thank you so much, Dr. Yasmin, for coming on the show and talking about your wide array of experience in healthcare and elaborating on the wonderful work that the government of Punjab has done. It's been a pleasure, and I hope to see you again soon. Allah Hafiz.
Thank you so much. Thank you, Bilal. Bahut shukriya.
Thank you.